I grew up in New Jersey. My first degree is actually in English literature, and I went back to school for nursing because some family members had cancer, and the nurses that cared for them personally affected me, where I wanted to change what I was doing with my everyday life. So I got my BSN from New York University, and I got my master's in nursing from George Washington. I worked about 6 years on a med-surg women's oncology floor in New York, and I moved down here about 2 years ago. I was doing a little bit of nursing leadership, and I've been here in the Pediatric Convenient Care for about a year. My mom had cancer, and my grandmother also had cancer around the same time. And at that point, I was working in advertising and just feeling like I wasn't doing everything I could do with my time. And I decided I wanted to make a change. So I was actually thinking pre-med, and I took an organic chemistry course because that was what I would need to fulfill my requirements. And I was volunteering in a pediatric emergency room just on my free time. And when I was there, I really enjoyed my time with the nurses as opposed to the physicians. I thought I really was able to connect with the patients, have more of a dialogue, understand where they were coming from, and that's what made me decide to go the nursing route. I was working on the medical surgical floor that I was working on, and we had a lot of nurse practitioners on the floor that were working, and I saw how they were really able to help the patients, help them get through their diagnosis, manage it, achieve an ultimate health, if you will. And I've always been the type of person that always wants to learn more, achieve more, constantly be challenged. And I just decided that that was my ultimate goal, to get there, to be able to do what I saw role models doing every day while I was at work. Well, I have a daughter, so I have experience working with kids, but I love kids. They are so resilient. They can be sick as they can be, and they're still running around, having a good time. I mean, that's not every patient, but to be able to help them get better is very rewarding and has been a blessing to work here for that. Pediatric Convenient Care is a walk-in clinic that patients can come to from 8 a.m. to 8 p.m. at night. We also have extended hours on the weekend, so 8 a.m. to 5 p.m. I think it offers an amazing service to the community for parents that are working during the day, that they can bring their kids after work, they can bring their kids on the weekends. Ideally, it'll prevent unnecessary trips to the emergency room, unnecessary use of antibiotics by going to urgent cares that may not be as familiar with a pediatric patient. Also allows them to keep a medical home, in the sense that if this is their primary care doctor, they can still see someone that works with that doctor and can see their whole health record, even when they're just coming in for a runny nose or a sore throat or something like that. I run, I do yoga. I used to paint a lot, so I do that once in a while. I like to listen to live music, go out for dinner, that sort of a thing. I'm enjoying the beach because I'm not from here, so that's a nice, relaxing way to spend my free time.